Hello, everyone. Um, this is my medication administration bundle protocol PowerPoint. I'm just going to present to you why I think pediatric inpatient units should be implementing a medication administration protocol. Medication errors are a common mistake in the healthcare field. On average, the U.S. Food and Drug Administration receives over 100,000 reports of medication administration errors in the United States each year. These errors are worse to vulnerable, more susceptible patients, such as the pediatric population. Children are at a greater risk of injury to medication error due to their smaller sizes and limited ability to communicate, and the fact that they rely on non-medical caregivers as compared to the adult population. Healthcare providers of pediatric patients need to consider reducing the incidence of pediatric medication errors, especially in the inpatient setting, to reduce the possibility of harm. So I propose implementing a medication administration bundle protocol in the acute care units to reduce medication errors. So what is a medication error? Hughes and Bludgeon define medication errors as preventable events that can lead to patient harm or giving inappropriate medications while a healthcare provider is involved in the care of patients. This definition relies on the settings for such events within the professional practice while using healthcare products, prescriptions, labeling, ordering, transcribing, dispensing, administering, and monitoring. Medication errors can occur at all levels of medication administration, and nurses are the last level of protection between patient and medication administration. So, some of the causes of medication errors can be from increased unit distractions, decreased unit funding, decreased hospital funding, poor unit staffing, or increased staffing ratio with regards to nurses and nurse assistants. And they can lead to increased patient mortality, longer patient hospital stays, decreased staff morale, and decreased trust in medical staff. So, what's the most common factor? Distractions. Though several factors contribute to nurses performing an error in the acute care setting, Donaldson et al. Concluded that distractions and interruptions while medication administration was occurring were the most common factors that altered the nurse from safe practices and diminished medication administration accuracy. According to Mano et al. And Fickelman, students claim that many medication errors happen due to distractions. Although most medication errors occur in the ordering phase, the administration phase is the second highest error time. And during this phase, nurses are most heavily involved and can significantly enact change. So I propose that a new medication administration policy be implemented on pediatric inpatient units. A medication administration bundle protocol should be implemented to minimize distractions during the administration phase. This bundle would include a quiet zone for medication preparation safety checklists. It would require nurses to double check high alert and hazardous drugs with other nurses. It would implement a pause before administering medications and would include ongoing staff education of medication administration information from a nurse-led committee. Yoder et al. Performed a similar study implementing safety zones to support medication administration that led to increased staff awareness to reporting medication errors post-intervention when compared to pre-intervention. And David Hizer also briefs on a study performed on a hospital unit that implemented 12 two-hour stress management educational courses on preventing medication errors to a group of nurses. This study showed a reduction of medication errors by 65% in the experimental group when compared to the control group of 45%. These results lean towards the idea that reducing stress in combination with medication error prevention education can improve the outcomes of patients. As defined by Sewell et al., a stakeholder is anyone who has something to gain or to lose from a project. For this project, the stakeholders would be the patients involved, the nursing executives, nursing clinicians, and staff nurses. The patients stand to gain safety and medication administration from the nurses administering prescribed medications during their stay. If nurses safely and confidently administer correct doses to patients, patient safety is enhanced, and medication error injuries will diminish. By this improvement, nursing clinicians will gain increased unit safety and increased patient satisfaction and nursing satisfaction. Medication errors have the potential to increase hospital length of stay for affected patients by 1.7 to 4.6 days, adding up to an additional $3.5 billion of healthcare costs nationwide. These financial savings and possible shortened hospital stays can also appeal to nursing executives involved. All stakeholders involved in this project stand to benefit from the projected safety improvements of this project. Beneficiaries of this project are ultimately patients that are being affected, but directly target medication administrators on the unit, namely nurses, providing a protocol that allows the nurse to stop, look, and think about each medication before administering it in a quiet space, free of distractions, reduces the chance of error. So again, some of the benefits that can come from this protocol being implemented. For the unit can save money. It can create unit leadership opportunities and improve staff morale and increase retention, and also raise awareness of medication administration. And for the patient, the benefits include decreasing patient mortality from medication error prevention and improve their outcomes. It also can create a better nurse-patient relationship and increase trust of medical staff by preventing medication errors. So for the outcome of this protocol, I expect to see a decrease in medication administration errors after implementing this project. Schnock et al. Showed the reduction of medication errors after implementing interventions and providing evidence that reducing errors requires a multifaceted approach to improve medication administration. So success in an area like this would look like fewer medication errors in any given time frame and improving patient outcomes throughout the length of hospital stay. In conclusion, medication errors are a problem experienced in healthcare that can potentially harm patients, especially the pediatric patient population. Nurses are on the front line of administering medications to patients, which means that they hold the responsibility of keeping their patients safe from errors. Distractions can contribute to administration errors the most, so implementing a medication error prevention program on a pediatric inpatient unit can significantly reduce medication errors and improve staff accountability. So here's a summary of this PowerPoint in a concept map. It just lists out the risks and benefits of medication errors. Here are some of the references that I used to prepare this project for you all. And thank you for listening. I appreciate it.